pre-birth, a name for when you give birth alone. I've heard about people having ecstatic births, orgasmic births, and my first was so painful and traumatic. It was incomprehensible for me. I went into labor, put on this like hypnotic music that I had been doing hypnotic breathing with throughout my pregnancy. I had this beautiful altar with all these things that my friends had brought me and affirmation cards, a bouncing ball and a birth tub in my bedroom. I called in my women ancestors and asked them to come and hold space for me. And I just danced on the ball and I danced through the contractions, and I just really sat in like extreme gratitude. I didn't feel scared at all. I was really anxious the week leading up to her birth. Like, am I gonna die next week? And then once everything started happening, it was just like complete calm, knowing that I was totally okay. And I was so connected to her. I felt every movement. She was in her sac. The babies who are born in their amniotic sac, there's really cool history around that and them being kind of like mystics. She's some sort of shaman. She guided me to have this experience.
Can yoga pants actually be a cause for infertility? That's one of the things that we're diving into today with Dr. Elizabeth Wade. She's a fertility expert and a mother who's experienced both the trauma and the empowerment of childbirth. In this episode, you're going to hear how infertility can offer hidden lessons for growth, why trusting your body and your intuition is essential for a successful pregnancy, and the real reasons why fertility is dropping globally and how it's impacting both men and women. Dr. Wade shares her powerful story about how she gave birth in her bedroom alone. And if you're planning to have a baby, what is the best intervention protocols to do to optimize your chances of getting pregnant? We talk about how birth control and IUDs can really disrupt your chance of having a healthy pregnancy, how seed cycling can actually help your hormones, and why your gut health is the secret to unlocking better fertility and a healthier pregnancy. If you ever wondered how much control you really have over your fertility, this episode's going to be for you. You're going to learn everything you need to learn to have a healthy pregnancy. Let's jump in. Thank you for joining this episode of Heal Thyself. To support the show, please rate, review, and subscribe. It gives us the opportunity to really expand this knowledge to people who need it most, and you can do your part by just sharing the love. Again, thank you for listening. I'm forever grateful, and I love you all. Let's get started. The fertility queen, I got some questions for you, rapid fire.
All right.
Okay, look, we got the nervous system calm. Now we're going to upregulate it back. We're going to come back.
I'm ready.
All right. Can infertility sometimes be a blessing in disguise?
Absolutely.
Oh, I can't wait to talk about that one. Okay. Do people rush into pregnancy way too quickly?
That's more nuanced.
Okay. Well, I like that one too. Does healthy parenting lead to healthier babies?
Yes.
Okay. Can preconception education prevent future complications?
Absolutely.
Okay. And I got one more bonus one that I'm just thinking of. Can nervous system dysfunction prevent a healthy pregnancy?
Yes.
Oh, can't wait to talk about that one too. All right, now I'm jazzed up.
All right.
Okay, welcome to the show, Doc. Look, I know that you've been doing this work for so long. You have 2 kiddos yourself. And before we get into like the beautiful world of fertility and even learning about infertility and all the preconception stuff, foods and supplements and lifestyle stuff, I've got to start with this. You gave birth in your living room by yourself?
Bedroom, but yes.
In your bedroom by yourself? Okay. Can you please paint the scene for us? What the heck? I've never heard of someone by themselves giving birth. Please paint the scene.
Yeah. Thank you. Thank you for letting me share this story, because it's the best thing that's ever happened to me. And it was really, there's obviously history there. I had my son 7 years ago and I wanted to have a home birth, and I did have a home birth, but it was quite traumatic, as unfortunately it's not just home birth, but birth can be traumatic for a lot of women. I was actually looking at the stats of that recently, and they say around, 30%, 40% of women report having traumatic births. And I definitely see that in my practice. And, unfortunately for me, there was a series of events that happened with my son. When I delivered him, I ended up having like a postpartum hemorrhage and being in emergent care, and I had to go to the ER after I birthed him. And was really just kind of removed from my body and the experience. And when I was reflecting back in my second pregnancy about what went right in my first birth, what went wrong, like how did I feel? The thing that was very clear was that when I was in early labor, in the phase of where woman is dilating, I was alone and I was just with my partner and I was just very in my body. I was listening to these hypnotic meditations. I was very much just connected to the baby and myself. And when my midwife came and my mom came and a doula came and a birthing student came, like all these people came to my house and there was so much commotion and it really brought me out of my experience. And that's when everything went south. And I was told, or my midwife came and she checked me and she was like, you're already at 10 centimeters. She was like, you were born to give birth. Like, 'cause I was so calm. I was just so calm and in my body. And, you know, right after she said that, like everything just changed and it became really difficult. And I ended up pushing for a tremendous amount of time, like 3 or 4 hours, which is just kind of wild. And then had this hemorrhage and yada, yada. So I had this intuitive feeling of like, I think I just want to do this alone, you know? And then I would share that with my partner or with, you know, my family or friends. And everybody was kind of like, are you sure? Like you were hospitalized, you know, a hemorrhage can be life-threatening. And don't you think you want to be in the hospital? And I was like, I really just feel like I need to be just in my body with my baby. And I was scared. I was definitely very scared. And I spent pretty much the whole pregnancy toying with this idea of, am I really going to do this? I started working with a different set of midwives and shared with them. And they're like, we can do this. You know, we can just kind of be in your house and hold space for you. And so they kind of, you know, encouraged me to still work with them, but have that safety net there. And that felt really good to me. But around 37 weeks, they came for a home visit and it became more clear that they actually wanted to be a lot more present than I realized. They wanted to come check me every like 15, 30 minutes. And I just didn't feel great about that. And a friend of mine who knew me was like, I think this isn't going to work for you. And I think you should find something else. And I'm so grateful for her because she's someone who's had 2 hospital babies, both loved her birth experience in the hospital. So it's not in her comfort zone at all to be like, do this alone, you know, but she just knows me so well. And she really encouraged me to maybe make a shift even that late in pregnancy. So at 39 weeks, I switched midwives and I hired a different midwife who was like, I will just sit in your driveway and I won't come in your house, like so that I can just say, you know, I was driving there, but I'll be there to like hold this safety container for you so that you can just do this and feel safe in case an emergency happens. And it was the biggest gift, you know, her creating that, like having some sense of protection there in case an emergency happened, but allowing me to really just stay in this place. I feel like my daughter was driving this decision. Like there was just this nagging sensation that I had all throughout pregnancy that I couldn't really understand. I never considered free birth, which is typically the name for when you give birth alone. And it was incredible. I mean, every moment, like I've heard about people having ecstatic births, orgasmic births, and my first was so painful and traumatic that I thought that was like, it was incomprehensible for me to feel that way. And there was never any moment, you know, I went into labor and I put on this like hypnotic music that I had been doing hypnotic breathing with throughout my pregnancy. And I had this beautiful altar and with all these things that my friends had brought me and affirmation cards and flowers and a bouncing ball and a birth tub in my bedroom. And I just danced with my daughter for my entire pregnancy on this ball. My father unfortunately had passed 5 weeks prior to her birth. And so it was a really tender time. I was in this like big life death portal. And, you know, at first, like he was there and, you know, I listened to music that he passed to. I was with him when he passed and had this big release with that. And then I called in my women ancestors and asked them to come and hold space for me. And I just danced. I had all this music. I had this playlist and I just danced on the ball and I danced through the contractions. And I just really sat in like extreme gratitude for, I get emotional when I think about this, for just being able to be in this space and get this experience. Like, so many women struggle to get pregnant and, you know, don't actually, I think, allow themselves to like really sit with what they want. And I was so clear in that moment that like I didn't feel scared at all. I didn't know how I was going to feel. I was really anxious the week leading up to her birth. I was like, am I going to die next week? You know, like I was so anxious. And then once everything started happening, it was just like complete calm, like knowing that I was totally okay. And I was so connected to her. I felt every movement she made down my birth canal. I didn't know it was a girl. I thought I was actually having a boy, but it was incredible. I mean, we just, you know, to have that experience, to feel everything and not feel scared, and just like I just kept saying thank you. And the power of gratitude, like every time contractions got really intense, if I wasn't actually just saying thank you, like thank you for, you know, these sensations, thank you for, you know, this experience, like they would feel more intense. And I really got into this flow of like, okay, I just have to like be like continuously thankful and verbalize this. And so it was just this practice of like, I'm here, I'm with you, I feel you, like thank you, like guide me. And it was, I don't know, it was like out of this world. It was the most powerful thing. I feel like there was just one point where it got really intense and I'm like, I think I need to get into the tub. But she was so low in my birth canal when I stood up from the ball, I was like, oh my gosh. And so I sat back down and I was like, this is like, I need to get into the tub. So I really wanted to birth her in the water, and I was by myself. So I got my clothes off really quickly and I got in the tub, and within 3 pushes, she was out. And I was very verbal at that moment, and kind of roaring. And so my partner at the time and the midwife came into the bedroom then, and she was in her sac. Like she came out in her amniotic sac, and she's a Scorpio. So babies who are born in their amniotic sac, it's called like in call. And they're like, there's this really cool history around that and them being kind of like mystics. And I feel like she's just, I don't know, she's some sort of shaman or something. Like I feel like she guided me to have this experience. And then, yeah, the midwife just kind of put her on my chest and she was like, do you want to check the gender? And I'm like, I don't care. Like, all that was going through my mind in that moment was like, did you see what I just did? Nobody saw it, you know, but I just was looking at her dad and I was just like, I did this, you know, like we did this. And I couldn't believe it. I just had never felt so empowered and so grateful. I feel like I just, like, any doubt I'd ever had in my intuition, it just went out the window. Like my whole life, my intuition has always been really strong. I think all of our intuition is very strong, but there's different experiences or people that influence us to make us second guess ourselves. And that was just like a really defining moment in my life of never not trust, because like that ping was there the whole pregnancy, but you know, society and fear and, you know, these like birth norms were kind of telling me like, don't do that, you know, you can die, there could be an emergency. And there were so many reasons to not, but I listened in the end and I got this tremendous experience and gift that like, I don't know that anything could ever top that day in my life. You know, it was like, I was just like, I'm a fucking goddess. And, you know, I just like fully stepped into this power that, you know, I feel like she helped guide me to. And I don't think it was coincidental, because I work with women in pregnancy all the time. And I really think it's part of my journey to help women like re-establish a connection with their intuition and like reclaim their power in birth.
Thank you for sharing that story. It's the first time I've ever heard about a woman giving birth by herself. It's incredible. And in the fashion that you did it, I mean, I'm such a proponent of movement and sounds, right? And gratitude and connecting to the body. And you just did that, right? And I wonder how you just align yourself with the evolutionary mechanism of birth and how it's actually supposed to be. But something that I didn't expect to hear from this is the reclaiming of your power. Was the reclamation of your power a function of you feeling in your body this to be true and fully following through with it? Or was it going through the process that is, by all intents and purposes, extremely hard to go through and overcoming it? What was the moment that you found your power in this experience. Hey everyone, I want to talk about something we rarely think about but impacts us more than anything else, and it's the air we breathe. Did you know that we breathe over 11,000 liters of air every single day? That is way more than 3 liters of water that we drink and the food we eat. But here's something that blew my mind. Most of our homes are basically working against our health. I know that sucks to hear. They're built for cost efficiency, but not human efficiency. The materials in your home are still off-gassing while you're living there, and most HVAC systems are not properly designed for optimal air quality. This is where Jaspr comes in. They are focused on something I've become passionate about, and that's turning your home into a sanctuary for your health. You start with your air that you breathe, always. Think about it. We obsess over organic foods and filtered water, but we don't think about the thing that we consume the most, and that's air. Poor air quality affects everything from your sleep to your energy levels. Jaspr partnered with Aura and saw that one of their clients, when they got a Jaspr, their score jumped from 61 to 91 on their sleep overnight after optimizing their air. That's life-changing sleep. So if you're ready to transform your home's air quality and feel the difference, visit jaspr.co/DRG. That's jaspr.co/DRG and use the code DRG to get $300 off for a limited time.
I think just trusting, the midwife that I hired at 39 weeks, when I was talking to her on the phone about why I was looking to change midwives that late in pregnancy, she said to me, I get it. Like cats, if you think about cats and animals in nature, they like go under a deck, they hide, they will swat anyone away from them who tries to come near them. Like they just want to birth alone. And I, when you think about that primarily, like there's no, in nature, like we're mammals, right? So there's like other mammals are not taking birth courses and like they don't have midwives and doctors. And there are really good statistics around modern medicine decreasing neonatal death. And so we have really made a lot of advancements over the last 50 years and, less babies dying in birth, which is huge, Not the same with actually maternal mortality rates have actually gone up in the last couple of years. But I think, I don't think there's a right way to do it. I don't think the way that I did it was right necessarily. I think it was just right for me. And I think that that's more the thing of that I was having this intuitive, strong pull throughout my whole pregnancy that came out of nowhere. Like I had never had interest in free birth. I actually thought it was kind of irresponsible, to be honest. And when I was in medical school, there was a student who shared that she had a free birth and, her child was born with like the cord wrapped around their head and had some problems. And so that was my only real experience with that. And it kind of freaked me out.
Yeah.
So when I was getting these downloads to birth her alone, I was like, where is this coming from? And then the medical part of me started going to the research around like what, around free birth and things like that. And then there was just but there was a bigger pull of like, I don't actually want to medicalize this. Like, I don't want to be a birth worker. I don't want to take courses on free birth because that's not really my interest. And I'm not trying to become a doula or birth worker. And I think that's more it. It's like, we don't need, the blueprint is in us. I tell this to all my patients, like, you just remember that you were born with the blueprint to birth. Like on a primal level, women, like we are born with this coding within us. And I think for me with my son, I realized like when there wasn't external factors there, I was just able to tap in and like let the hormonal cascade and the communication between me and baby unfold fully. And when people started intervening, everything got messed up. And so I just intuitively felt like if I just create an environment where there's no external, interruption, like I trust that it'll either unfold or I will know when to intervene, So I think it was just that following that guiding, those guiding principles and really, and then having, obviously I didn't know how it was going to turn out. So when it was that beautiful and that powerful in the end, I was like, this was incredible, and just over the moon. And
you have a healthy baby.
She's so healthy. And everything was so easy. I mean, my postpartum was so hard with my the first couple weeks. Like it was painful. My body felt really disoriented. And I was like, I could give birth 1,000 times after birthing her. It was just like the easiest transition. And everything's been easy with her. And I don't know, I've thought a lot about that, like how the birth experience affects children too, because traumatic births can affect the babies and then their life experience, you know?
Yeah, well, I'd like to go more into that because you have 2 kids. One, they didn't go like conventional hospital, right? It was a midwifery and...
It was home birth, but I ended up in the hospital like 4 hours after I birthed him.
Okay. You as a mom, at least intuitively right now, what do you notice any difference between the 2 children in the way that they were birthed and how they're expressing now?
Yeah. My son is definitely more anxious, and I feel like I wasn't able to connect with him. I actually get I get pretty emotional when I think about I was in so much pain and so disoriented at the moment of his birth. Like I didn't think I could do it. I thought I was going to die. And I lost so much blood that I was like half dead. You know, my mom, my partner was like, you were gray. And like my partner almost passed out. So I immediately, when they handed me my baby, I handed him to my doula. I handed him to my partner. And then he was like, I'm going to faint. And so he handed him to the doula. So my baby like didn't get to connect with me right away. And I wasn't able to like welcome and receive him in the way that ideally I would want to, because I was not okay. And, you know, and then they were, you know, had to get IVs in me and, you know, were trying to stabilize me and stabilize the bleeding. And so, you know, I was kind of just like a shell of a human. And it took a while. It took until I got stabilized in the hospital to be able to really connect with him. And we have a beautiful relationship, and he's a wonderful, wonderful, you know, child. And I think we've made up for a lot of that early, you know, misconnection, but I do feel like he's more anxious. And I feel like my daughter is so, like, from the moment she's been born, it's like she's so embodied in this way of like, you know, even in regards to like stomach upset, you know, he always was kind of like, he didn't have colic, but he was always kind of moving around. He seemed uncomfortable in his body, you know, and she's just been like, I can just see that she's just good, you know, like it's just fine. So yeah, I do think it made a difference.
It makes a difference. Okay. So there's viewers and listeners going, oh, whoa, I'm pregnant or I'm about to get pregnant. What are the indications, contraindications, like who should watch out? Like should we have a doula, midwife, a doctor right outside the door right there? Like I want to be able to responsibly recommend this. Yeah. And how do you talk to your clients and patients about this?
Yeah, well, we just don't really have a lot of data, you know, on, I think it's like less than 1% or around 1% of births are free birth. So there's just not data, you know, on that. So I don't, you know, and again, I'm not like a free birth expert, you know, technically because the midwife was on site. I don't know if it even really qualifies as a free birth, but felt like one. And there's not a lot of midwives that will do that. Like the midwives that I was using my whole pregnancy, they were wonderful, and I actually refer patients to them all the time. But, you know, legally for their licensure and certifications, like they have to, you know, they have to check women's and the baby's heart tones every 15, 30 minutes. And so they weren't comfortable, which is okay. You know, that was just not within their comfort zone. And this midwife was more rogue. She was trained by, you know, home birth midwife instead of a hospital midwife. And she, you know, just kind of was comfortable, you know, just being like, I'm just going to be in your driveway, you know, holding space so that I'm driving there and I can just document that. But I don't know that there's a lot of practitioners that will do that. And I'm friends with a free birth worker, and there are people who will come and hold space that are familiar with birth and not necessarily certified midwives or doulas. But I don't know. I don't know that I have like a specific recommendation. Obviously, if there's if a woman has had a prior C-section, you know, usually in this country they recommend another C-section. In other countries, you know, they will do vaginal birth, which is called VBAC, more fluidly. But in our country, it's usually they try to schedule C-sections. So if a woman has had a prior C-section, that might not be the safest option for them. If there's pregnancy complications with preeclampsia or, you know, that chronic health conditions of the mother, that would put her at higher risk for birth complications. That would be something to consider. My patient population tends to be a little bit leaning more towards wanting to do home birth. I would say maybe 60% of my patients end up having a home birth, but a large percentage, 40% have hospital births. And I think the biggest thing is just, the biggest piece of advice I give women is, stay connected with your body and your baby throughout the pregnancy. Know what makes you feel safe. And be your biggest advocate for creating an environment that allows you to stay feeling safe and stay feeling connected to your child. And know that you can always pivot. Like, in my first pregnancy, I had pings that my midwife wasn't exactly what I wanted, but she was a really established midwife. I felt like she was kind of the matriarch of the midwifery community in Portland. And I was like, she'll know to keep me safe because she knows she's so experienced and I should just kind of ignore these concerns I have and just, it'll be fine. But I think that was a mistake, because I'd never given birth before. So I just was more looking for experience versus like trusting myself and what I was feeling. And so it's really all about safety and just feeling safe. And so what means safe for me, I think is going to be very different from other people. Like that friend of mine who encouraged me to change midwives, like she feels safe in a hospital. That's not where I feel safe, So I just don't think there's a right answer.
To really tuning in where your body feels safe enough to go through that really, really deep process. And for you personally, the environment played a role because you were in your bedroom. Bedroom. I said living room 3 times. It's bedroom.
It's okay.
I'm just picturing, where's there a tub in your bedroom? But why would there be a tub in your living room too?
I mean, they bring tubs, like the midwife they'll bring you like a tub.
Okay,
set
cool.
it up. Yeah.
So they got the setup tub. And what if that was in a beautiful Zen midwifery room in San Francisco? Would that have changed? Was the fact that you were home, did that play a major role?
For me, yes, because I don't particularly feel safe in hospital settings.
Right.
I've had some, trauma, PTSD from different things in hospital settings. So for me, my body doesn't feel safe. Like that doesn't make me feel safe. So for me, being home felt important. But I can imagine, if my home were really far, say from a hospital, I might not feel safe, in case an emergency happened. And in that case, I might elect to go into like a birthing center where I was in, again, like a really beautiful kind of room by myself, still able to monitor things, but have access then to hospital care close by. So there's definitely a lot of options.
Yeah, I feel that. I'm just so still in awe of that. I mean, how many places around the world, countries, is this kind of regular or indigenous? Right? I wonder how often we see something like this. I have a question. I was reading once and they said, no, the prime way to give birth is actually standing up. Is this true? Standing and squatting?
I mean, yeah, squatting, definitely. My first birth, the midwife brought like a squatting chair, like a birthing chair where you're in like kind of the perfect position to squat. And I did end up birthing my son in that position. But yeah, I've definitely seen videos of women birthing babies standing.
It's incredible.
Some women birth babies in water. That's a big thing actually in some places in the world where they go into like the ocean or lakes and rivers and birth like in a natural body of water, which I think is a whole different degree of like badass that, I really enjoyed birthing in water. Significantly reduces the pain, even though I only pushed 3 times versus 3.5 hours with my first. I only had 3 big pushes to get my daughter out when I was in the water. They were pretty intense, pretty painful, those 3 pushes. That's why I was kind of roaring. So, I definitely felt way like the pain level was far beyond with my son when I was out of the water. So yeah, birthing in water felt really good to me. And yeah, you could be, I don't know. I think it's just like being allowed to be in your body. My first birth, the midwife kept telling me what to do. And I don't really like being told what to do. So it was a very, uncomfortable position for me because I was really overwhelmed. And I also didn't feel like I had autonomy to really speak up and say something for some reason. So I just was like begrudgingly kind of moving around in the way she wanted me to move, but it wasn't intuitive and it wasn't following, the guidance of my child. And
I wonder if the next level midwife is like somatically informed midwives, where they are opening the space for the mom to actually tune into her own signals and move and sound based on that, a full somatic experience connected intuitively to the baby. And then whenever they need to guide, they come in and guide, come in, pull out, come in and guide, pull out.
Yeah.
I don't know. Listen, this is not my field, but I know somatics is, and I feel good about this.
Yeah.
I feel good about this.
Yeah. And some women like lots of touch. I have friends who are naturopaths and, have had a couple babies, and they were like, wow, like when I loved my midwives and my doula because they were like massaging my, my hips and my back.
Mm-hmm.
And so some women really need and want that physical touch and want that support. Yes. And so I think it's just, I've always kind of been like, let me do it my way type of person. So I think for me, it's no doubt. And now seeing my daughter, she's the exact same. Like she's just kind of like beats her own drum and like doesn't care what anybody else's thinks. So I don't know. I think it's just a different formula for everyone.
I understand. It is different for it. But this, I'm sure the audience is very much so piqued in their interest to hear something like this. And that's a really fantastic story. I really thank you for sharing that. I love when people come in here and actually put me in this state where I'm just like, whoa, I'm like in awe, and I was kind of hypnotized by that story. It was fantastic. I want to switch the gears, move out of that soul experience into science now. Yeah. We love the science. 2 naturopathic doctors who are grounded in the body's own ability to heal itself, grounded in the natural interventions, but we love the science too. We have a state of the world where fertility is dropping down. Mm-hmm. Unless I'm behind on the newest research, but I think it's still consistent based on what I was looking at recently. What in your opinion is the reason fertility is dropping?
I mean, environmental toxins is the first thing that comes to mind. I think that, that's a huge reason, especially for male fertility. It's very rare that I look at a semen analysis report and have it be good. Very rare. Whenever it is, I'm always like, wow, you should be really proud. Because it's like 1 in 20, 1 in 30. It's very rare. So, and male fertility, there's a book actually by Dr. Cohen called The Countdown. And it's on the decline so drastically that this doctor has written a book, basically saying that we're at risk of becoming extinct, if it keeps dropping at the decline it's dropping at the rate. And so what was, once considered normal, for male fertility, like all men 2 decades ago, essentially now would be considered infertile if we were basing the World Health standards for what good fertility for men was. So the World Health Organization has this criteria of healthy sperm parameters in terms of count, morphology, and motility, which is shape and how they swim and how many. And they keep having to lower the standards of normal to accommodate the mass drop in male fertility. So it used to be normal to have, 50% of your sperm be a normal shape in, 1970. And now 5% is our standard. Lord. 5% normal
That's we're swinging low here.
Yeah. And so men will, they'll go to fertility clinics, for example, like, yeah, we had a semen analysis and they said everything was fine. I'm like, let me see it, because we still want at least 15% of the sperm to be normal optimally for good fertility. So, even if they get 5%, I'm still like, there's still room for improvement here, and then motility, and count has gone down dramatically. Before it used to be like, 20 parts per million. I can't remember the exact numbers, but it's so low now as well. It's just gone down so low that, we just keep having to lower the standards, which is kind of alarming. So, and reactive oxygen species and, and things that cause kind of oxidative damage and stress to the body is a big form of that for men, why we're seeing that decline. So I think that's a huge piece. And then I think it also affects women and how their eggs are, women have, all the eggs that they're ever going to have in their lifetime at the time of their birth. Actually, when their mother was 20 weeks gestation with them, they had all the eggs they would ever have. So we have this epigenetic also potential, right? With pregnancy and birth, it's like whatever our grandmother was doing when she was pregnant with your mom, is actually impacting your health and your eggs because your eggs were inside your grandmother when she was pregnant with your mom, which is wild. So women are often told, like, you have old eggs. A lot of women wait to have babies until they're older now. I have a lot of patients who are in their 40s who are trying to get pregnant. And once you're 35 as a woman, you're considered like a advanced age or geriatric pregnancy, which is not a fun term to be labeled as. But so part of it is women are trying later, but the studies really show that women across all age groups are seeing declines in fertility. So it's not just older women struggling, it's women in all age groups we're seeing decline in fertility. And there's a whole myriad of reasons why that is. Chronic health is rampant in this country. People's gut microbiomes are really messed up. And our ability to detox is really impaired when our gut is impaired and our liver is burdened. And a lot of people suffer from liver issues and, chronic metabolic issues. And then we have a lot of toxins circulating around. Even if we're trying our best in our homes and in our controlled environments, we're still exposed to a tremendous amount of things.
Okay, so when you say environmental toxins, is there one toxin that is really like, man, this is probably the thing that is causing so much of this? I
don't think there's one, no. I mean, BPAs, phthalates, parabens, the big ones, all of them that are endocrine disrupting, chemicals. So they mess with your hormones. All of those contribute, in different ways to some of these declines that we see and imbalances we see. Big causes of female infertility are polycystic ovary syndrome, PCOS, and endometriosis. And, both of those are severely impacted by the gut microbiome. And, we know that toxins that are increasing inflammation, increasing hormonal imbalances contribute to that too. So,
and I know that you are well-researched and you do a lot of talks on the gut microbiome. And this is something that off air we were talking about. How does the gut microbiome affect fertility?
Yeah, well, we're more microbes than we are human cells. So the microbes in our body are really running the show. They are constantly communicating with every organ system in our body. They make several hormones themselves. They're connected to our gonads, which create our, fertility hormones, both men and women. So it's, there's a lot of research. I've been working in the field of gut microbiology for 7 years as like a researcher and a speaker for one of the leading gut microbiome companies in the US. And so I've really dived into the research on the gut microbiome, and there's, a huge connection with low diversity and PCOS. When people have really low diversity of microbes in their gut microbiome, they're more at risk for polycystic ovarian syndrome. When we have the wrong types of microbes in our gut, we're more inflamed, and, a lot of inflammation is stemming from that gut inflammation. And so like endometriosis is really driven by inflammation. And so there's a big connection there. There's also, there's microbiomes. We know a lot about the gut microbiome now, but there's a microbiome in our uterus, in our endometrial microbiome, in our vaginal microbiome, oral microbiome, our skin microbiome. And they all impact, each other. Like none of them are exclusive from one or the other. And so there's actually really cool emerging research on the vaginal microbiome and infertility. And because there's a lot of money in IVF, in IVF, they've done a lot of studies on causes of unsuccessful IVF and reasons why that might be. And then they will treat women with antibiotics or something that's, they will treat vaginitis in women like BV or things of that nature, and see that IVF rates skyrocket. So I think they've identified that maybe like 60 to 90% of unexplained infertility in IVF after they treat vaginitis, people will go on to have a successful pregnancy. So there's a huge amount of research now going into the vaginal microbiome and that being a cause of unsuccessful IVF. And that lab that I've been working for a long time as a consultant, they, in the last couple of years, have a vaginal microbiome test. So it's pretty interesting to see people's vaginal microbiomes. Now, a lot of providers will order this for their patients, and then they make consults with me, and I help explain them what the results mean so they can take it back to their patient and utilize it appropriately. And that is also pretty alarming. Like, our vaginal microbiome should be predominantly Lactobacillus crispidus, and we can categorize our vaginal microbiome in different community state types. And so lactobacillus species create lactic acid that keeps the pH low in our vaginal microbiome, and that keeps pathogens from being able to be present. And again, I think it's like 1 in 10 reports that I see that actually has a vaginal microbiome that's dominant Lactobacillus crispus. It's usually a non-stable environment that's non-Lactobacillus species, things that might lead to like BV, like Gardnerella. There's a bunch of different pathogens that might be present that could create a less stable environment, essentially, and create an environment where more pathogens can survive. And so if you're somebody who has dealt with recurrent vaginitis, which might look like yeast infections or UTIs or BV infections, it's a really good idea to, work on your vaginal microbiome, especially if you want to get pregnant in the next couple of years and really try to address, vaginal microbiome.
So this is what I'm hearing then.
Yeah.
Chronic vaginitis, BV, yeast infections could be a signal that you may have issues getting pregnant later.
Mm-hmm. Yeah. I would say it feels like the most exciting area of research in infertility right now, the vaginal microbiome connection. Yeah.
Wow.
It's pretty profound, some of the studies that are coming out around that area. And it's not that hard to change. It's just, again, like, it's all connected. There's so many women that wear synthetic yoga pants all day, and that is not a good, situation for your vaginal microbiome. It can't breathe. It allows for these microbes that don't like oxygen to be present. And so we want to create an environment where there's airflow, organic cotton underwear, cotton, non-synthetic pants and clothing where there's like proper airflow. We don't want to be using harsh chemical soaps and things like that in that region. Really just water is all you need, to cleanse your that area in your body. And, a good diet and supporting your gut microbiome and things like that are all important as well. Not smoking and drinking and things of that nature. So they're all connected. It's not like one thing. The environmental toxins doesn't influence, they all influence each other, obviously, but it's not that hard to kind of reverse it. It's actually quite easy. I mean, the lifestyle stuff is not easy to make lifestyle changes, but you can make some minor adjustments with maybe after you work out, changing into breathable, a clean pair of breathable cotton underwear and, more airflow pants, and maybe not wearing, synthetic yoga pants anymore.
Okay. So that's really helpful information. What I'm hearing, and my question is, so you're saying that these popular yoga pants can be the reason women are getting BV?
Mm-hmm. Yeah, because you need airflow. So you just don't want to be, and someone like, say you go to the gym and you work out and then you just stay in your yoga pants all day. Like, you don't want to do that, So whenever someone has like recurrent BV, I'm always telling them, like, after you work out, make sure you change your underwear, change your pants, and ideally you should just be wearing cotton,
because of the chemicals.
Right, because of the chemicals. And you also want things that are breathable. So synthetic fibers are not breathable.
Mm-hmm. Yeah, makes sense. A lot of them are like really polyester dominant. You look and it's kind of hard to find 100% cotton anything for working out.
Yeah.
It's really hard. I was looking for myself t-shirts and I was like, great. 15% polyester, 10% polyester, 30% polyester. Yeah. I'm like, oh man.
You really have to read the fine print.
You have to read the fine print and you have to get really familiar with it, especially if you're trying to have a baby. Mm-hmm. We were talking about this off air, and this is something that intrigues me because it's my space that I really love doing this work with, is that can trauma from sexual trauma, even something as a woman not wanting to have sex with someone, but being like, I'm going to abandon myself, all that memory in the system, can it manifest in the womb and ultimately create infertility?
I believe absolutely. Yeah. As a female provider, that predominantly my patients are female. I would say 90% of them are female. I have worked with, thousands of women, and I ask on my intake form. My intake form is very long. Women always tell me, like, I've never filled out an intake form that comprehensive. And one of the questions I ask is, name your top 3 traumas. And I can't tell you the amount of times that I see sexual assault in that list. It's, it's really heartbreaking, actually. And there is a huge disconnection for women with their wombs. So, I do a lot of workshops in Portland, Oregon, where I live, on what I call womb wellness. And it's helping women really reestablish a connection to their womb and do meditations and clearing practices where they work through the emotions that come up when they're in a space connected to their womb. And this work was really inspired. I took Tammy Kent's holistic pelvic care training. I don't know if you're familiar with her, but she wrote a book, Wild Feminine, that's really popular. And she's actually local to Portland, but she was a pelvic floor physical therapist for 15 years. And, pelvic floor physical therapists are there to help women strengthen, the tone in their muscles in their pelvic floor. So when women are older, it's not uncommon for them to have incontinence, where they might leak if they jump on a trampoline or laugh or things like that. There's poor pelvic tone or prolapse, where parts of their reproductive organs are kind of prolapsing out of their vaginal canal. And so that's what pelvic floor PTs do. But she was realizing in this work that every time she was having women kind of connect with this space in their body, they were having these emotional releases. So there was just a lot there. And so she branched off from that more conventional PT work and kind of created this holistic pelvic care model, where you do physical therapy for the pelvic floor, but you create a container and a space and kind of guide women through a meditation while you're doing that work to allow for that more free movement of those emotions to come up and clear. And I was really inspired to do this training because I had an ectopic pregnancy when I was 30 years old, which is when the embryo gets implanted somewhere outside the uterus. And so in my case, it was in my right fallopian tube, and I had to have emergency surgery and removal of my right fallopian tube. And it was quite traumatic. And finding a provider who did holistic pelvic care was really the needle mover for me, of like allowing me to fully process what had happened to me in this space in my body. And that was the catalyst for me really connecting with my own womb after that, because IUDs are one of the causes of ectopic pregnancy. So at the time, the surgeon who did my surgery, who was also an OBGYN, was like, I went in to see her for a post-op visit, and she was like, you can't. I was on the oral birth control pill at the time that I got pregnant with that ectopic pregnancy. And she was like, you can't be trusted with the pill, clearly, which is shaming. And it was like a terrible thing for her to say. And then she was like, I recommend that you get the IUD. And I was like, well, I read that IUDs are a risk factor for ectopic pregnancy, so that doesn't feel good to me. And that's when she said to me, well, you clearly can't be trusted with the pill, so this is your best option. And so I said no, because I intuitively just didn't feel like that was right, but I didn't really know what to do, for contraception. And a friend of mine in medical school was like, have you ever heard of fertility awareness? And I hadn't. And fertility awareness is kind of an umbrella category for different methods where you can track your cycle and figure out when you're fertile, so you can avoid intercourse or use another form of contraception during your fertile window. And so my friend hired this fertility awareness educator to come and teach a workshop to me and like 8 other students in medical school for a weekend. And, she was a huge expander for me in terms of helping me like really learn my cycle and connect with my menstrual cycle and reconnect with my womb. And my whole life changed from learning this practice. And that was really what led me into the work of fertility, because that was in the first year of medical school for me. So it was a really big shifting moment in my life, and kind of a reason why I decided to specialize in fertility and start, helping women with understanding more about their hormones and their menstrual cycles. So many women, just myself included, are just put on birth control at a really early age, and they don't really have any relationship with their cycle. They are not cycling, because when you're on birth control, you're actually not getting a period. It's a withdrawal bleed. And a lot of women, including myself when I was on it, don't realize that. A lot of women have no idea what's actually happening, what hormones are at play during their menstrual cycle. They either have sexual trauma or birth trauma or trauma from their relationship to their periods, because they've had so many, years of painful periods, and their period being inconvenience and a hard thing for them to experience. And so a lot of my work, especially early on in my practice, was really focused on, helping women kind of reconnect with their womb and have opportunities to kind of heal the relationship and have healthy periods that don't feel traumatizing and don't feel painful and learn about their body and, be able to actually have a relationship with this space that, one day is going to be home for your future baby. Like, it's so important.
When you would do these such sessions or ceremonies, what emotion was most potent coming out of women?
Tears, grief.
Deep grief.
Deep grief.
Yeah. So in my work, that's not surprising. In my work, usually like the final boss of like these layering of repressed emotions, particularly in women, is the deep grief shame, like that I'm unlovable or I'm not good enough or all that stuff. And it's usually in the womb.
Yeah.
And then you layer on top of that sexual trauma or past surgeries, miscarriages, abortions, all that memory there that was never processed, if it never was. Oh my God, it's like a volcano erupting. I always say this story because it's one of my favorite stories. And it was a client who came to me and she was going to get IVF in like 2 months or something. And I said, okay, let's go through this process. And we went through this emotional release process. It was her first time. And she was crying and crying and crying. I said, okay, well, oftentimes women cry in the first part of this. And then her fist started closing, her face got red, she tightened up. And I go, okay, here comes the anger. And usually when someone says, I feel angry, it's right in the belly. Like it's somewhere in the belly, like near the liver usually. They were right, Chinese medicine.
Yeah.
And then usually I'll challenge that and do my own practice with, some fascia stuff, and it comes out and moves, and they see the part of them that is angry, and they're like, I love you, and I'm angry, it's okay. This was in her womb, right side. And right before she said it, I go, oh, this isn't in the belly, and then she goes, it's right here. So I'm going in the womb, and I put my thumb, so I pressed on it. You could see she was kind of like, I challenged it enough that it was like right there, the verge of like right enough. And then we started connecting to this voice from under my thumb. Like, what's really the true voice, the sound that is under my thumb and pushing harder, and she starts shaking. And there's some sound that comes out. And then there was a bubbling sound. And I felt it bubbling from under my finger, and it bubbled up her belly, bubbled up her chest. And this sound that came out was like an explosion, like a crack. Her voice cracked open. Can you believe in a month later, that woman got pregnant after 2 years of not being pregnant?
I'm not surprised at all.
2 years. And this was the emotional component. And this is why you see in the women, this is so healing. The work you're doing with these women is because you're opening that space, all that contraction in the fascia, energetically contraction. Now it's opening.
Yeah.
So that was like one of the best. I was like, she got pregnant. And she said, I didn't even know, without the awareness, that every time my husband was going to enter, I closed my legs. She closed her legs. Oh, and because this happened in college, something happened where she had sex with her boyfriend, but she didn't want to. And she said no, and he just forced himself. And that memory was there. And so she actually made the somatic decision to relax her body and like kind of welcome that. And I'm pretty sure that that's probably the time she got pregnant, or if not close to that time.
Yeah.
Isn't that incredible, those signals that we give the body?
It is. Have you seen the book, or do you have the book Metaphysical Anatomy?
No.
Okay, you need to get it.
How did I never read this?
I don't know. I was recently gifted it actually this year, and it's been blowing my mind. I will frequently bring it into my practice, and when people bring up conditions, we'll look at it together, and they're always like taking pictures or ordering it off Amazon right afterwards because it hits every time. And I last year I met a woman, maybe it was a year and a half ago, but I met a woman in Hawaii who was a birth worker, but she wasn't a fertility birth worker. She doesn't have any credentials, but she dedicated her whole life and study to this work, and she was doing lots of programs. She's got pretty big community.
Yeah.
And she's really into like the metaphysical aspects of that. And we really hit it off. We spent like the entire day together on a beach in Hawaii. And she was talking about how she had these, gigantic fibroids when she was in this previous relationship that was really out of balance, and once she got out of that relationship and, was living more in alignment in healthy relationship with herself, and her body, like they all resolved, and naturally without any surgery or anything like that. And it really got me thinking. I had an issue where I had like a pretty large cyst on my right ovary a couple years ago, and I went into ovarian torsion, and this is some of my hospital trauma. I went to the hospital and like they didn't see it on the ultrasound. They thought it was my bladder, and they were like, we don't know why you're upset, like you're fine, you know. And I had a 10-centimeter cyst in my right ovary that was cutting off blood supply to my ovary. And when they finally did an MRI with contrast, which was unnecessary because they already had an ultrasound, you know, they figured out what it was. And then I was like rushed into surgery, and they're like, you were really close to, you know, losing your ovary. And so there's like, just some more hospital trauma for me. But I was looking into, I went so into the research, and I couldn't find anything about this type of cyst that I had. And I was asking all my OBGYN colleagues, I was like, what causes these types of cysts? I can't find anything in the research about it. And they're like, we have no idea. They don't fund research on women's health. Like that was the answer I got every time. And I was like, this is so infuriating. I couldn't find any reason for why I had developed this cyst. And when somebody bought me this book, they sent me this metaphysical anatomy book in January this year, and I read what causes right-sided cyst. I mean, it could have been like a script from my life.
Hold on. Let me guess, because I'm really kind of writing my own metaphysical anatomy without knowing, because I've seen so many patients in this. Does it have to do with relationship to the father?
Relationship to the mother.
To the mother. Okay. All right. Yeah. There's a parental relationship, and
you would think right-sided might be father,
right-sided. I was thinking father.
Relationship to
because it's womb.
Yeah.
Interesting. Okay. What else? Tell me.
Yeah. So relationship to the mother, you know, my mother's lovely, but you know, we've had stuff, and there's been like, in my life, like I've felt kind of silenced and stunted to being able to speak my truth without being shamed. And so, you know, at the time that cyst was there, you know, things were not great in my relationship with my kids, with my father, the father of my kids, and with my family. You know, after my dad died, there was just a lot of stuff that came to the surface with my family. So there was all of these really big emotions present. And, you know, I have this core wound of like being too much, you know, and like every time I speak up, it's like you have too many opinions, like, you know, you're too sensitive, you're too much. And so with my family and, you know, even in that partnership, I kind of just silenced myself because I didn't want to like feed into this label of like being too much. And I, you know, my doctor at the time was like, you're boiling inside because you have all these big feelings, but you're afraid to actually voice them. And so, you know, I think she was spot on, but it was really, you know, when I read that chapter, I couldn't believe, you know, I sent it to my best friend, and she was just like, wow, who's also a naturopath. Like just, whoa, you know, it was so spot on. And yeah, I mean, I never figured out the reason for this cystoadenoma that I got on my right cyst. It has nothing to do with hormones. I did a Dutch test. All my hormones were great. Yeah. I was like, this makes no sense, you know, but when you think about what was happening in my life when that was there, it was like, wow, that was really prominent.
If you came to me, I would think hormones, environmental toxins, or mental, emotional, psychosomatic, something.
Yeah.
It has to be one of those, you know, and yeah, like, again, that's like that core wound of the shame. I am too ashamed to be big. I am too ashamed to voice. I am too ashamed. And I would have thought it was connection to father because it was that side, but right if it's in the womb, so it's incredible. Anyway, I love, you know, I wish this whole show, I wish every Heal Thyself episode was about this stuff. Yeah. But okay, so there's people out here going, okay, me and my partner, we want to have a little baby. Yeah. It's time. We're thinking about this. What are some of the things right now? Let's say they're a year out. They're just talking about it.
Yeah.
I have some friends already talking about it. Kind of what's important now? You know, what's important right now to start intervening in? Yeah.
1 to 2 years is a great, like, optimal time to really be setting the stage and foundation. I imagine a lot of your community probably already is, without knowing, doing some preconception work, because a healthy lifestyle, movement, working on emotions, like things like that is all part of it. But definitely a year out, you don't want to be on any synthetic hormones, any synthetic birth control, you know, even the non-hormonal IUD, I would say get out, because that can increase your odds of getting vaginitis and vaginal dysbiosis. So having natural cycles, trying to heal, you know, if you went on birth control to suppress, you know, a hormonal imbalance, like pulling off that plug, and allowing it to come to the surface so then you can heal it, and let that guide your healing process. You have to work with a provider or, do your own research and figure out how to balance your hormones in a way where your cycle is the right frequency. You want to be between ideally 26 and 32 days. Online they'll say 25 to 35 days, but I would say 26 to 32 is kind of more optimal. You want to have, the healthy amount of blood flow. That should be somewhere between 25 and 80 mils. So if you're using a cup, you can look at how much your cup holds and start tracking how much blood flow you're losing month to month, because some women are really unfamiliar. All they know is a really heavy flow. And so if you ask them, how's your blood flow? It's normal, but really dialing in of is this a normal, healthy amount to bleed? So 25 to 80 mils, making sure that, your period shouldn't be painful. If you're having painful periods, that's a sign that you're probably inflamed. You probably got some sort of hormonal imbalance, inflammation going on. So addressing that, you shouldn't feel like your best when you're bleeding, but it shouldn't be painful. You shouldn't have to use pain medication.
It should never be painful. You're saying periods should never be painful.
Not painful. Maybe uncomfortable, maybe a day where you just kind of feel sluggy, but it shouldn't be more than a 1 to 2 out of 10 in pain scale rating.
And what's going on if there is pain every month? Usually
inflammation is driving up these prostaglandins in the body that are increasing contractions and increasing that severity of the cramping. And so I would say it's most common for women to report painful periods, and they think that's normal. And it is normal in the sense that it's common, but it's not physiologically healthy.
Is it a dietary thing? Is it a genetic thing?
Yeah, I mean, diet can definitely play a role, because you can get really inflamed and your gut microbiome can get really dysbiotic from having a poor diet. If you don't have good detox capacity, which is our liver, our kidney, our GI tract, our main detox organs, then so if there's backup within phase 1, phase 2, phase 3 detox, which we can go into if you want, all of those things can impact your ability to properly clear estrogen. When you metabolize estrogen, it's supposed to goes through phase 1, phase 2 detox in the liver, and then it gets sent to your GI tract to be excreted in your stool, and your kidneys to be excreted in your urine. And so there can be blockages along the way in any of those detox areas. Environmental toxins, a lot of environmental toxins mimic estrogen in the body and, disrupt your hormones. So that is a big way that things get thrown off.
Those are the big ones.
Yeah, those are the big ones.
And I want to go back to that preconception, but we veered into this because it's really important. I know more. I was just talking to my friend yesterday, and we were talking about her period. I don't even know how we got to that. And she said, they're pretty balanced, but the first 4 hours are extreme pain. And then I remember, my partner's girlfriend, the first day is like pain. And I remember one time it came on when we were out to dinner and she couldn't come to the movies with us because she was nauseous and kind of curled up. And I'm in my head, I was like, no, it shouldn't be this way.
Yeah. You wouldn't believe. I can't believe sometimes the amount of pain women will endure before seeking help. And it's actually sometimes it's not even that. It's that they've been to conventional doctors and the conventional doctors just give them birth control as a solution, and they don't, because that's all they know, but, or they just will say that, periods are painful. They don't actually address the issue. So it takes an average of 9 years for a woman with endometriosis to get a diagnosis, which is that's a really incredible. Long time, and there's not good care in the medical system. And it's definitely even worse for women of color and things of that, for other minority groups. So that's a whole different rabbit hole. But the womb work that I do with women, people will run into me in Portland and be like, I took one of your workshops, several years ago and changed my life. Helping women understand their cycle, really know how to develop a relationship with it, really know how to work with their bodies to try to course correct and have easier cycles. It's not the best time of month. Even for me, I don't feel, I would prefer just to have not a lot going on. I'm not in pain, but I don't want to have my biggest output, but we're in a masculine dominant society. We're expected to produce at the same capacity every day, but we have very different hormonal fluctuations from week to week. And it's pretty normal to feel like we have different capacity for output as women.
Yeah.
And that was, I think, the most empowering thing for me in taking that fertility awareness course that first weekend in my medical school, first year in my medical school, is like, oh, I don't need to feel shame. I don't need to apologize for, like, you know, people would be like, oh, I'm PMSing. It's such a kind of derogatory, like negative. It's just, this is actually my human design to not feel so great the week before my period. And I don't need to, like, that's just the way I'm designed. Like, I don't need to feel any shame around that. And I'm not actually going to tolerate anyone making comments around, you must be PMSing. So it's just like, this is just normal to not feel that great a week before your period. And you shouldn't feel terrible. Again, there's extremes, you know, but you're just a little bit more irritable and you're a little bit less social and you just kind of want to be more inward. And that's really normal. And so when women are tapped into their natural cycles, there's this huge empowerment of kind of understanding how they feel in their body. It's like, it's no longer this roll of the dice, like, why do I feel off? It's like, oh, I know. Right now I feel amazing. I just ended my period last week. This is the best time of the month for me. It's perfect timing for this podcast. You know, it's like, I love when life aligns like that. But there's certain times in the month where it's like great to be out in the world doing things, like stepping into your power, because it's like your hormones are in your favor in that month. And there's certain times when it's not. Yeah.
My partner's really good with that. She'll retreat and read books.
Yeah.
And like watch like YouTube videos about like really nice homestead farmers in like Scotland.
Yeah.
I'm like, all right, well, I'm just going to do my thing.
Yeah.
And then literally a few weeks later, running sprints all over Venice, you know, it's like, that's it, you know, if that's ever it. And I want at the end, I want you to mention that course for everyone, because it's crazy because there's a lot of women who don't even know what hormones are up and what hormones are down. And because they just went to the doctor once and got birth control and have been on that cycle and then gone into IUD and then been on that, and complete disconnection from women. I actually, in the work that I've done with the somatics, that is the number one thing I found. Women are mostly disconnected from the womb. And they only think about it with childbirth and then when they're hurting during their period, if they do. And it's a whole conversation. Okay, so back to the preconception. You said a year or two is really important time around it. Really getting off of the birth control, of course, you got to get off of it, the IUD. And there's going to be a bounce back time to get back to normal too, right? Like if you're getting off the IUD, I remember I worked with this client once, it took forever to get back her cycle. The body's just having to readjust. Yeah. So let's say they get back their cycle. What are we doing now?
Yeah. So, you know, correcting any imbalances that come up. Some women don't start cycling again. So that, you know, you have to have a period to get pregnant. You need to ovulate. So making sure you're ovulating, you know, when you do fertility awareness and you track your temperature and look at track your cervical mucus every day, that those are the signs from your body that you're in your fertile window, that you're ovulating once your temperature rises. So, you know, learning that, there's good resources and books and stuff that I help point people to with that. And then, you know, trying to clean up your lifestyle is huge. So I always recommend people go on the Environmental Working Group website and print out the Healthy Home Checklist and go through their home and really start identifying where some of these big, you know, toxic chemicals are in their homes and doing their best to start replacing them. It's really overwhelming. In my environmental medicine class in medical school, that was an assignment we had, and I was pretty natural and thought I was pretty green and clean on a lot of stuff, and it was still alarming to me some of the places that I had missed. So, you know, I think for it to not be that overwhelming, like really giving people time to make those changes, because it's not financially feasible for most people just go replace everything they own right away. So starting with the big things that you use every day, if there's like a body lotion or a shampoo, or if you're putting fragrance on your body, synthetic fragrance on your body, starting with those big things like everyday exposures, and then working towards maybe investing in an air filter, like an air doctor or water filtration system in your home, and trying to get maybe a better mattress and different things like that, like the more expensive changes to make.
Absolutely.
Really working on the gut microbiome. I feel like I'm the biggest advocate, you know, when people ask me what is the one thing I can do for my health, it's like work on your gut, and don't assume just because you have good digestive function, if you're having regular bowel movements every day and you're not really bloated or gassy, you know, having reflux, heartburn, that doesn't mean you have a good gut microbiome. I can't tell you the amount of, you know, I've looked at thousands of stool analysis for people all over the country, other providers, will run the stool test, and then I'm a consultant for the lab, so they can book an appointment with me, and I will go over this 20-page stool analysis for their patient and help them explain what is happening. And nobody has good gut health. I never see one where I'm like, this is great, they don't need to do everything. Like across the board, we all need gut support. And that is a huge, in my preconception course, I talk a lot about that because, again, the gut's running the show. It affects your hormones, it affects your detox, it affects your brain, how you feel, your mood. It affects whether or not you're going to go on to get dementia or Alzheimer's. It affects everything. So there's not one chronic condition that I've seen yet where I can't find research to show that intestinal permeability, leaky gut, or low gut diversity isn't at the root of it. So we all have work to do there. And, I'm the biggest advocate of fiber, functional fibers. I give all of my patients a handout on functional fibers. Like, these are the foods that are high in inulin. These are the foods that are high in resistant starch, the different oligosaccharides. So that is very clear what they should be looking for at the grocery store. And I'm like, diversify it, change it up every week, and that takes time. Like, we can't just in a month, revamp our entire life. Most people, some people do, you definitely have those patients that are like, they just do it all. But for it to not feel overwhelming and then people burn out, it's like, we really want to give ourselves that time to make these incremental changes and start doing these things at a pace that feels sustainable, so that it's more of a lifestyle. It's not like a cleanse or a detox that we're doing. It's like we're trying to create healthy habits.
100%. And the diversity is everything. So I'm so happy that you looked at so many stool analysis and then connecting this back to this whole picture of fertility.
Yeah.
We got to diversify, and it takes time, but we can add in the colors of the rainbow.
Yes.
But you're saying, don't keep the same foods in the colors of the rainbow. Switch it up. We always have to be switching it up. The reds can't be the reds the same every week. It can't be raspberries every week.
Right.
Raspberries are great, but
we
gotta switch it up.
Gotta switch it up.
Okay, amazing. All right, and is there any really important, you mentioned cleaning up the house, getting the air filters, water. Obviously, getting your stress down, getting out of alcohol, drinking stuff, lowering alcohol, smoking, obviously the working out. Is there anything supplementally that people can talk to their doctor about? Is there something that maybe a vitamin D or something that we really got to pay attention to?
Vitamin D is massively important for fertility, and most people are low. If you do blood work on your patients, ideally we like to see vitamin D between 50 and 75. And so if you're running a vitamin D test, check to see where you're at. But most people need more. And that's really low vitamin D is linked to PCOS. A lot of women have PCOS. So I, always optimizing vitamin D. When you conceive, you're not going to know. They count how many weeks gestation you are based on your last period. So by the time women find out they're pregnant, they're 4 weeks pregnant already. And the heart, the neural tube defects, that starts at 17 days. So if you're low in folate or B12, that affects neural tube, starting a prenatal or starting supplementation after you're pregnant, it's a little bit too late. So you really want to optimize those micronutrients. You want to have a methylfolate ideally in your multi or prenatal. You want to have good sufficient levels of methyl B12 as well. And you can check blood levels of B12. They're all right. It's hard to get good readings on that, but I still run them. So B12, folate are huge. Vitamin D, zinc, selenium, iodine, those are really important for thyroid health. Thyroid issues are a big cause of infertility and hormonal imbalances. So I'm always looking at those. I'm big into fat-soluble vitamins and making sure people get fat-soluble vitamins where, traditionally we would get them from organ meats, and we don't eat organ meats a lot in this country. So I personally don't like them. So I will supplement them here and there to get them into my diet, an high quality organ meat supplement. But usually you want to do D3 with K2, whole food form K2 is better than synthetic. And so that really helps with, driving calcium into bones and teeth. So when we think about developing babies and, they're growing, their bones are growing, their teeth are growing, we want to have all these essential nutrients at play. So part of it is diet, part of it is how you're absorbing. So that's, again, why you have to really think about it of your gut, because you could be taking all the supplements and eating all the right things, and your gut can be totally messed up and you're actually not absorbing the nutrients. So, it is both dietary and gut for sure. We have great bacteria in our gut. There's some bacteria in the gut that can actually make B vitamins and make K2. So I'm a huge fan of spore-based probiotics because they will increase our capacity to make B vitamins in the gut and K2, and then we can absorb some of that and see that in the serum levels. Supplements, there's a lot of like antioxidant supplements that are great, CoQ10, NAC, green tea, ashwagandha, that are great for male fertility. So there's like a blend that I really like putting men on to optimize their sperm. Men have like a 90-day period that the spermatogenesis process is happening. So from start to finish, brand new sperm every 90 days. And we don't really know where a man is in that process. And so we definitely, like I call the trimester, the 4 to 6 months before you conceive, is your trimester. And that's a great time to be taking, you want to do all the lifestyle stuff, dietary stuff in the year, 2 years prior, ideally. But the 4 to 6 months before you actually start trying would be an ideal time to really add in supplements, a lot of antioxidants, make sure you're not using cannabis, drinking heavily, sauna, steam room, like overheating the testicles can be really bad for male sperm. So looking at more of those lifestyle factors, and good omegas are really important. I always see you post about the omegas you love. So high quality omegas are really important for improving hormones for men and women. I
love that. Yeah, I mean, that's a rundown. If we ever had this on the show. That's beautiful. I love that. So we are ready to have some babies. This is what I'm hearing. Viewers, listeners, me, maybe you again. We ready to have some babies. I love it. We got all the information here. And I just appreciate how thorough, but also how much soul was really put into this, because, you painted a beautiful picture, and I could tell that you love what you do, and
you do.
And, practical stuff. So as we round out the end of this podcast, what viewers and listeners out there, right? They may be wanting to get pregnant or looking to get pregnant, just hormonally. Like, how are we going to optimize our hormones? What are some of the best ways that we can optimize our hormones? Just what's a good practice to wake up and do in the afternoon and at night? Just what does a good day look like for our hormones?
Yeah. Having a good regular sleep schedule is amazing for your adrenal glands, and your adrenal glands are really connected to your sex hormones. So the HPA axis, it's called, but that's your hypothalamus, which is in your brain, your pituitary, which is in your brain, that is, these messengers to all of your sex hormones, essentially. And then your adrenal glands is the A in the HPA axis. And so one of the best things you can do for your stress and your adrenals, supporting your adrenal glands, is having good regular sleep habits, going to bed, waking up at the same time, waking up and get morning sunlight, setting your circadian rhythm, really trying to optimize your melatonin production at night, not being exposed to too much synthetic bright lighting. So one of the things I did recently in my home in the last year was like change all the lighting to full spectrum, incandescent or full spectrum lighting, non-flicker. Also, there's some really wild research around, these flicker LED lights, and that being a cause that young women are going into like premature puberty, women going through puberty really young, like 9 years old. And that the flicker actually being part of that. If you videotape it on your phone in slow-mo, you can see how much your lights are actually flickering. And so they use LED because it's building, it's efficient, they're efficient lighting. But natural lighting, like I have lamps in my house that have lights that are, more in like the amber dim side that I put on at night. And I don't use any of the bright lights in the evening in the evening. So setting up your home environment to be more conducive to like that natural rhythm. A lot of people have really disrupted circadian rhythms, which mess with their hormones. And so, that's why if you go camping, like if you ever go camping for a week or even just a few days, it like resets your body in a way because you're sleeping and rising with the sun. And that's kind of how we were designed, to do, which we're so far from that now. So trying to, in your home as much as you can, kind of have some sort of a cadence that mimics a natural wake and sleep cycle. That is a really big one. great for hormones. I really love seed cycling. I can't say that patients love seed cycling, but if a patient does seed cycle, which is using flax and pumpkin seeds in the first half of your cycle, and then once you ovulate, going to sesame and sunflower, I can't tell you how many times I've seen patients get, you know, a 28-day cycle, day 14 ovulation from a month of seed cycling. It's really effective. So there's an article on that on my website, you know, if you want to learn how to do that.
But more on that. What is it about? Why do people do it?
People do it because so flax is a phytoestrogen, and so it kind of works as like an adaptogen with estrogen. So if you're too low or too high, it can kind of help balance it out. It's also a really great fiber for the gut microbiome. So there's a lot of, you know, it's great for the skin. Flax is really a wonderful thing to add into diet. It's good omegas. And then pumpkin seeds are high in zinc and some other nutrients that support the hormones that play estrogen in the first half of your cycle. Sesame and sunflower seeds are the seeds you use in the second half, and the nutrients in those help support progesterone production. And so, you know, I don't know, it's like an old kind of thing, kind of like castor. I'm a huge fan of castor oil packs.
But what do people get their period back, or
their cycles will regulate. They'll have, you know, they might have 35, you know, day cycles, and then they go to like a 28-day cycle, and it'll, you know, the flow will decrease if they're heavy. It starts to balance out their hormones. And so I will often see women get like a 28-day cycle, a day 14 ovulation, which is kind of textbook and not always the way it looks. But people, it's hard to keep up with. That's a thing. But, you know, for maintenance, like just doing flax every day is also just great for your hormones. Freshly ground flax seeds, like 2 tablespoons a day, is great. Eating a good diet, feeding your microbiome, fiber. People are obsessed with protein. Actually, the stool test that I look at for, you know, other providers tests your protein fermentation byproducts. And so when we ferment protein in our gut, we make ammonia and these things called indoles and precressols, hydrogen sulfide, indoles. And those things in the right proportion are fine. But if you're over fermenting protein in your gut, which about 70% of people are, you're really inflamed because of that high protein intake, because you're making all these excessive polyamines and precressols that are damaging your kidney and messing with your gut lining, and ammonia messes with your brain and your liver and your kidney. I can't tell you how many people have excessive protein fermentation. So I'm really cautious with my patients of like, the reasons we recommend high protein are all valid, but let's make sure your gut can handle the protein first before we do that. And so in my world, fiber is king with the gut. It's like fiber should be the thing that we're all focused on most. And then once we have a healthy gut microbiome, you know, then we can focus on that, all that metabolic benefit of having high protein. And
wait, before we go here, because this is big, because you said something big here. So you're saying, and I know we're rounding out the show, but you're saying that before you go on a high protein diet, you got to get right with your gut?
Yeah.
Okay. And then can you just clear up again what you just said?
Yeah. So if you have bacteria in your gut that are over fermenting protein, every time you feed it protein, you're going to make these polyamines at higher proportions, precressols, ammonia, indoles. You know, we could go into each one, but I think we don't have time. But they're messing with your gut lining. So then that makes you have more of a leaky gut, more at risk for chronic disease, inflammation, and everything. Anxiety, depression, everything's linked to leaky gut. You know, if your liver is being impacted from the ammonia, or your kidneys are being impacted from the precressols, your ability to detox is going to be less efficient, you know. So we're going to be more inflamed and more dysbiotic in our bodies the more that we have these fermentation byproducts. And so, you know, every time we feed them protein, we're going to create more of these. So we have to kind of get our gut microbiome in a place where it's balanced. We're fermenting enough carbohydrates to make short-chain fatty acids, keeps our gut lining intact, make enough lactate to keep the pH low, that keeps pathogens from overgrowing. And then we want to have the right levels of these protein byproducts. And so we just need to make sure that we digest well. Part of that, good food hygiene, chewing your food, not being stressed at meal times. You know, try like using bitters or digestive enzymes or things like that can help. Not being constipated, that's a huge reason. Sometimes people can over ferment. If you don't poop every day, that's longer that food is staying in your colon, and the bacteria can over ferment it. low stomach acid, from stress or different reasons. A lot of people have low stomach acid. So, there's so many facets to unpack there, but really making sure, that your gut can handle that, because a lot of people are inflamed and they don't know why, and then they're just upping protein, upping fat, trying to be metabolically sound, but they can actually be inflaming themselves without knowing it.
Yeah, there's not really anyone saying that. So that was so helpful. That it's fantastic, because a lot of people come on this show and say you need to eat high protein in order to get your muscles right for metabolic health.
Yeah, and they're right.
They're right, but they're missing the step of saying, and get your gut right first. And the way to get the gut right is more diversity, sustainably over time, switching it up. So thinking, how can I get enough fiber and how can I get enough diversity in my diet of those rich foods that give me those different fibers that you were talking about? And then how long are we doing that for before we can go to that high protein diet?
I mean, it's a lifestyle, we really should just be eating a lot of fiber, 25 to 40 grams a day, and a lot of people can't tolerate it. So if you avoid fiber because it makes you gassy and bloated, that's like a sign. Your body's always communicating with you. So we can't just like overlook or suppress these signs by being like, okay, I'm not going to eat fiber because it doesn't make me feel good. It's like, well, we have to address, you have to be able to tolerate fiber.
Yeah.
The fiber is king in terms of healing your gut, like bringing the right microbes in that create a balanced, non-inflammatory gut microbiome. But a lot of people need a lot of help to get to a place where they can actually eat the high fiber diet.
Gotcha.
Yeah.
Okay, beautiful. Okay, we got the full picture. We are running out of time. Thank you. Look, this is a fantastic conversation. We need to know where we're going to find you. Where's the woman's womb work? Where do we find that? What was that book that you mentioned before, the metaphysical anatomy? There was another one that you mentioned about the womb. Let's rewind that part, and then where can we find you?
Yeah. So I'm in Portland, Oregon. My website, Dr. Elizabeth Wade, and that's my Instagram as well. So I'm the most active there. I have a course called Fertility Reclaimed. It's helping women reclaim their fertility, because this is like, if you want to have a natural pregnancy, I believe it's women's birthright to, try their best, to have that. And so the course is really just designed to help women take the foundational steps. It's like a 5-module course to really understand what's at play, all the lifestyle pieces, dietary pieces, how to balance your hormones, how to understand your hormones, things of that nature to set you up. So that's a great foundational course for women that are interested in like doing trimester work and really, I'm a big fan of it, because it's not just about, for me, getting pregnant. Like you would ask the question, does it change the health of the pregnancy? I think early in the interview, and from that epigenetic standpoint, like we have the potential to influence our grandchildren by the work we do in preconception. If we are in a better state of health, both people coming into the pregnancy, man and women, or woman and women, however you're doing it, the two people coming in play, the more you both work on your health, that's going to influence what genes are expressed when you have your baby, and the genetic expression you're passing on to your baby, and that's going to impact their future children. Yeah. So, there's a lot of potential to kind of create a much healthier child, for life, and a healthier pregnancy, healthier postpartum, and, just healthier adults, like for your child long term. The gut microbiome by the age of 3 is more or less set. 60 to 70% of our microbiomes as adults was set by the age of 3. So the more work we're kind of doing in this early postpartum, early childbearing years, it has huge payoff for our children long term. So that's what, it sounds kind of cheesy, like when I think about like, how can I change the world? Like I just think that there's not enough conversation about that. It's not so much like, can I get pregnant? It's like, is this the right time? Yeah. And just, can we slow down and take 3-6 months to prepare? And if you didn't do this, it's fine. I also I love to say, like, I don't want anyone to feel shame. Like if they already have kids and they didn't do preconception work, or, they had a traumatic birth. Like I had a traumatic birth. Like we only know what we know, but it's never too late to kind of jump in and start and start doing this work. There's always room for optimizing, our health and the health of our families and the people around us. So yeah, that course, I think is just wonderful. And then,
the books,
Metaphysical Anatomy, really very fascinating book. My favorite book on like really understanding your hormones and womb work. Well, I talked about Wild Feminine from Tammy Kent.
Was it.
But there's a book called The Fifth Vital Sign that is very digestible and easy to read. And that's a great resource for understanding the history of birth control, understanding the hormones at play during your menstrual cycle, and how to track your menstrual cycle naturally so that you can identify when you're fertile. And it's not really just for contraception or contraception. It's just really understanding your body and,
Amen.
Being in tune with your natural rhythms.
That's what we need. We need the women connected to their wombs and on fire.
Yeah.
She's moving the mountains already.
Men have a womb, an energetic womb. Did you know that?
Wait a minute. Hold on. let me just click this so we can use that on social media later. Men have an energetic womb?
Men have an energetic womb. In Japan, they call it the hara. And, so I actually got an opportunity. I was on a sale retreat in January, and I led a womb meditation to men and women, like equal men and women in the group. And I was so nervous because I had never led a womb meditation to men. But I was doing some research on, the energetics of the womb space, and societally, it is like considered this, this creative center, collective creative center. And so it's really a place where we can all kind of tap into our fullest creative expression. And I think where a lot of like birthing new ideas. So it's like this is where we birth babies, but it's also where we birth our creative expression from. So
yeah, my wound's popping then. It's on fire. All right. Thank you so much for coming on the show. I got to tell you, we had a diversity of subjects, but all within the same umbrella. So I love that. I love hearing new perspectives, new research, just new everything. So I appreciate that, and sharing your story, which was vulnerable, but also really deeply connecting for all of us. I can speak for the audience too. So
thank you.
I really, really love this interview. Thank you so much, Doc. I appreciate you.
Thank you so much for having me.
All right.